Hi, my name is Lacey Tamboli, and today I'm going to be teaching you a few things about instrumentation. The instruments we're going to be using are the periodontal probe, the 1112 Explorer, the 204S, the Gracie 1112, and the Gracie 1314. The first instrument we're going to start with is the periodontal probe. As you can notice, this instrument is used for measuring sulcus depths. Therefore, when using it, you notice the millimeter measurements that go by threes. So the first thing you're going to do with this instrument is you're going to insert it at the distal line angle, and you're going to push until you feel the base of the sulcus. You want to use your fulcrum with this instrument and make sure you are adapting it parallel at all times. You're going to start at the distal line angle and go distal on the most posterior tooth. You will get 6 readings for each tooth, and then once you're at come back to the distal line angle and you go mesial. From the most posterior tooth, you go distal line angle mesial on every tooth. When you switch quads, you will adapt the instrument the same way and do the same technique. You want to use light pressure with a walking stroke as you go along and take your instruments, and you will record 6 for each tooth. The next instrument we're going to be talking about is the 1112 Explorer. This instrument is used to detect subgingival calculus. The main use of this instrument is through tactile sensitivity. You're going to use this as light pressure as possible in order to adapt your instrument correctly and feel the calculus in order to be able to remove it. Therefore, the terminal shank of this instrument is going to be where the last bend is in the instrument. There is a correct way to determine which correct end of the instrument is going to be used depending on which quad you're working in. Therefore, one easy way to learn the correct end is using the premolar test. By using the premolar test, you're going to line it up between the 2 premolars and make sure the terminal shank is going to be parallel and not coming across the facial surface of the first premolar. So therefore, you would test this side, flip it, and test this side as well. And as you can see, this side would be incorrect because it comes along the facial surface of the tooth. Therefore, we would use this side. Using this instrument, it is going to be, like I said, a very, very light pressure, and you're going to go distal line angle distal on every tooth and then come mesial. Not only just the posterior, as we mentioned in the probe, but this instrument goes distal line angle distal, come back around to mesial on every tooth. You're going to adapt it parallel at all times and make sure you are inserting the tip third to correctly insert the instrument. You're going to insert at 0 and activate your wrist motion and come around. Make sure to turn your instrument in at all times while you're using it. You're going to come back mesial and make sure to adapt your instrument and activate your wrist the whole time to correctly feel the calculus. You would do this on all teeth, distal line angle distal, come back around to the mesial. And that's how you use the 1112 Explorer. The next 2 instruments we're going to be discussing are our Gracies. We're going to be talking about the Gracie 1112 and the Gracie 1314. These instruments are best used for posterior teeth, and they are going to be used for the removal of subgingival calculus. I like to use them mainly on periodontal patients where most of their pockets are deeper, and these instruments provide for better access to the deeper pockets. So the first instrument we're going to be talking about is the Gracie 1112. This instrument does have mirrored ends, however, it only has 1 cutting edge on each end, whereas your universal curettes have double cutting edges. So when using this instrument, you have to determine which edge is going to be your cutting edge in order to effectively remove the calculus. The best way to determine this is to look at your instrument, and you're going to see the lower end is going to be your cutting edge. Therefore, you're going to put the instrument at 12 o'clock, and you're going to see which end is the lower end, and that end is going to be your cutting edge. So to use this instrument, you're going to find your correct cutting edge, depending on which quad you're working in. So therefore, for quad 4 buccal, this would be my correct working end. And you're going to start, and this instrument is for mesial only. Therefore, you're going to start at distal line angle and come mesial. Make sure you parallel your instrument, stand up on your fulcrum, and make sure you are adapting it correctly the entire time. You're going to come distal line angle, mesial on every tooth until you get to the anterior region. And that is how you use the Gracie 1112. The next instrument we're going to be talking about is the Gracie 1314. This instrument is designed same as the 1112, but this instrument is used for distal surfaces. So whereas the 1112 you start at distal line angle and come mesial, the 1314 is designed to start at distal line angle and move distally. It is used for the subgingival calculus removal as well. And one thing I forgot to mention is curettes have a rounded toe, whereas scalers have a pointed tip. Therefore, in order to start using this instrument, we would first need to find the same cutting edge as we did with the 1112. We would take the instrument, put it at 12 o'clock, and we would look for the lower cutting edge, and that would be our correct end, and this would be this end, for instance. So therefore, activating it when going to use it, you want to stand up on your fulcrum, make sure to parallel your instrument, insert at 0, and start scaling distal line angle, distal. You do the same thing on every tooth, distal line angle, distal. Make sure to stand up your instrument, stand on your fulcrum, and do short overlapping strokes in order to remove that calculus. And that is how you use the Gracie 1314. The last instrument we're going to be discussing is a little different from everyone we've done. This is a 204S, and this is designed for a posterior interproximal scaler. Therefore, this instrument does have the rounded tip. It has more of a curvature design designed for interproximal calculus removal. The tip makes it easy to go interproximal and remove the calculus effectively. Therefore, you want to activate the tip by finding the correct end. The correct end of this instrument is going to be found by making sure it does not wrap the tooth. Therefore, this would be your correct end. Whereas this one, you would test it and it goes around the tooth, and we know that that is not the correct end that we want because it does not activate the tip correctly. Therefore, we would take this, and this instrument is used the same as the 1112 Explorer and your universal curettes in that it goes distal line angle, distal, and come back to mesial on every tooth. So you would take it, go through your tip, go distal line angle, distal, come back, come mesial, and make sure to parallel your instrument the entire time. And that is the 204S. There's not much you can... Now that we have discussed and demonstrated all the instruments that we're going to be covering today, I want to do a quick recap to make sure that all the instrumentation was thoroughly understood. So the first instrument we talked about was the periodontal probe. We said that this instrument is used to measure sulcus depth. This is crucial as a hygienist because you are going to take measurements almost every time you see a patient, especially if they're periodontally involved. This instrument has black markings and silver markings that indicate measurements by millimeters. They go by threes. Healthy measurements are 1 through 3, and anything 4 and over is considered a deeper pocket. Therefore, when activating this instrument, you want to make sure that you're going to use a walking stroke across the sulcus and make sure you are taking 6 readings per tooth. You want to take accurate readings to thoroughly evaluate your patient always. That is pretty much the periodontal probe in entirety, and you will be using it almost every day as a hygienist. The next instrument we discussed was the 1112 Explorer. This instrument is absolutely crucial as a hygienist. This instrument is used every single day, and especially for tactile sensitivity. You want to make sure when you're using this instrument, first, that you're using the correct end that we talked about. Make sure you're using the tip third and the terminal shank when activating it. When using your modified pin grasp, you want to make sure that your middle finger is resting on the shank, therefore you can feel accurately of what is under the gums. Once you have the correct end, you want to stand up on your fulcrum and make sure you're activating the instrument properly and using your wrist activation to correctly feel the calculus. If you are grasping the instrument too tight, you will be unable to feel it and might not be able to remove what is under the gums. 1112 Explorer is a very good instrument, and once you learn to use it, it will become your best friend. The next instrument we reviewed was the 1112 Gracie. This instrument is used for subgingival calculus removal, and as we said, this instrument is mirror-ended, but it only has one cutting edge per end, so you need to find the correct cutting edge before using it on your patient. To accurately find this edge, you're going to hold the instrument at 12 o'clock and find the lower cutting edge, and that will be the edge that you want to use. Therefore, this instrument, you're going to make sure you want to parallel and stand up on your fulcrum as well. The terminal shank is the very last bend of this instrument, and you're going to use this instrument from distal line angle to mesial only, because that is what this instrument is designed for. And that is our Gracie 1112. The next instrument we reviewed was our Gracie 1314. It is essentially the same as the 1112 in that this is its terminal shank. It is mirror-ended, but it only has one cutting edge per end. Therefore, when using it, you have to find your correct cutting edge as well, which is the lower cutting edge when held the instrument 12 o'clock. And this instrument is designed for distal surfaces. So you will activate this instrument by using light pressure, adapting it 1 to 2 millimeters, and you are going to use it distal line angle, distal subgingivally. The last instrument we have to talk about in our recap is our 204S. This instrument is a scaler. This instrument is not a curette, and it is designed for interproximal calculus removal in the posterior region of the mouth. Therefore, this instrument has a curvature, and this is the terminal shank where the instrument bends significantly at the end. That is the part of the instrument that you want to adapt. You only want to use the tip third of this instrument when you're using it, and it will be your best friend in removing interproximal calculus. You want to find the correct end of this instrument as well, and that end is where it is not overlapping the tooth, but it is using the correct end. And you want to activate it same as the others, 1 to 2 millimeters, and make sure you're using your wrist activation and the correct overlapping strokes again. And that is all of our instruments we are going to cover today. Thank you so much for watching, and I hope you learned something from this video.